To a great extent, every human deals with money on a daily basis. Every human being wants to make money. If not for anything, at least to make ends meet. So, it is fair to say that every human being has some sort of relationship with money. Do you know that some people have a phobia for money? Yes, there is such a thing. It is called chrometophobia. The fear of money may seem unusual to some, but for individuals with chrometophobia, it can be a distressing and debilitating condition that significantly impacts their day-to-day life. Chrometophobia is a psychological condition characterized by an excessive and irrational fear of money or wealth. It is classified as a specific phobia, which is a type of anxiety disorder. People with chrometophobia may experience intense anxiety, panic, and avoidance behaviors when confronted with money or financial situations. In this video, we will explore chrometophobia in detail, including its symptoms, causes, impacts, and treatment options. Symptoms of chrometophobia. Chrometophobia is typically associated with a range of symptoms that can manifest both physically and emotionally. The symptoms may vary in intensity and duration from person to person. Some common symptoms of chrometophobia may include intense and excessive fear or anxiety related to money or financial situations, such as handling money, counting money, or discussing financial matters. Avoidance behaviors, such as avoiding places or situations that involve money, refusing to handle money, or refusing to engage in financial activities. For example, a person with fear of money may avoid job opportunities that involve financial responsibilities or require dealing with money, such as managing budgets, negotiating salaries, or handling financial transactions. This can limit job options and career advancement opportunities, leading to financial insecurity and reduced quality of life. Physical symptoms often include anxiety. When exposed to money or financial situations, individuals with chrometophobia may experience physical symptoms of anxiety, such as rapid heartbeat, sweating, trembling, shortness of breath, chest tightness, or nausea. These physical symptoms can be distressing and uncomfortable, and may even lead to panic attacks in severe cases. Sleep disturbances. Chrometophobia can also impact an individual's sleep. Anxiety and fear related to money may lead to sleep disturbances, such as difficulty falling asleep, staying asleep, or having nightmares related to financial worries. Lack of quality sleep can further exacerbate the physical symptoms of chrometophobia and negatively impact overall health and well-being. The long-term physical health consequences that often lead to chronic stress and anxiety associated with chrometophobia can also have negative effects on an individual's physical health over time. Prolonged stress and anxiety can weaken the immune system, disrupt hormonal balance, increase blood pressure, and contribute to the development of other physical health conditions, such as cardiovascular disease, gastrointestinal issues, and chronic pain. Emotional distress, such as persistent worry, fear of losing money or becoming financially destitute, or anticipatory anxiety about future financial events. Interference with daily activities, such as difficulties in managing finances, paying bills, or making financial decisions. Chrometophobia may lead to depression and mood disorders. The chronic anxiety, stress, and emotional distress associated with chrometophobia can increase the risk of developing depression or other mood disorders. The constant worry and fear related to money can negatively impact an individual's mood, leading to feelings of sadness, hopelessness, and loss of interest or pleasure in previously enjoyed activities. One of the biggest effects is the impact on self-esteem and self-worth. Chrometophobia can impact an individual's self-esteem and self-worth. Individuals with chrometophobia may feel inadequate or incompetent when it comes to managing money or financial matters, which can negatively impact their self-esteem and self-confidence. This can further contribute to feelings of shame, guilt, or worthlessness, leading to a negative impact on overall emotional well-being. Still talking about emotional distress, people with chrometophobia have often reported it causing impaired relationships, for example, avoidance of money-related situations or ongoing anxiety about financial matters, which create strain in personal relationships, including with family members, friends, romantic partners, or colleagues. The lack of awareness of this phobia makes family members, loved ones, or colleagues have a false perception of someone who suffers from chrometophobia. It can lead to difficulty in managing joint finances, planning for the future, or participating in shared financial responsibilities, which can create interpersonal conflicts and strains. Social impairment and avoidance behaviors such as avoiding social activities that involve money, difficulties in job roles that require financial responsibilities, or strained relationships due to financial issues. Individuals with chrometophobia may engage in avoidance behaviors such as avoiding shopping malls, banks, or other places where money is commonly exchanged, which may impact an individual's daily activities and routines and relationships with loved ones. Causes of chrometophobia. The exact cause of chrometophobia is not well understood, and it is likely to result from a combination of genetic, environmental, and psychological factors. Some possible factors that may contribute to the development of chrometophobia include traumatic experiences. A traumatic experience related to money or finances, such as a past financial loss, bankruptcy, debt, or financial fraud, may trigger the development of chrometophobia. The fear may be a result of associating money with negative or traumatic events and developing a fear response to it. Learned behavior. Chrometophobia may also be learned through observation or conditioning. For example, if an individual grows up in an environment where money was a source of conflict, stress, or anxiety, they may develop a fear of money as a learned response to their environment. Genetic predisposition. There may be a genetic component to chrometophobia, as individuals with a family history of anxiety disorders or phobias may be more susceptible to developing chrometophobia. Neurochemical imbalances. Imbalances in brain chemicals, such as serotonin or dopamine, which are involved in regulating mood and anxiety, may also play a role in the development of chrometophobia. Personality factors. Certain personality traits, such as high levels of neuroticism or anxiety sensitivity, may increase the risk of developing chrometophobia. Individuals who are naturally more anxious or sensitive to stress may be more prone to developing an excessive fear of money.